The number of female physicians entering the workforce is growing. Today, women represent 50% of medical students. Yet they report less control over their day-to-day work, lower compensation, greater strain in the work-home integration, and are more likely to report burnout than their male colleagues. Through an 18-month grant sponsored by the Physicians Foundation, the AHA and 5 other major medical organizations teamed up to help improve organizational structures and build individual skills of female physicians through the Women's Wellness Through Equity and Leadership, or WEL project. Welcome to Advancing Health, a podcast brought to you by the American Hospital Association. I'm Tom Hedderly, Executive Speechwriter for AHA. At the beginning of the WEL program, we interviewed 3 physician leaders. Today, now that the program is concluded, we're catching up with these women physician leaders to hear about their lessons learned and advice for others looking to do this work.
Welcome to a podcast in the American Hospital Association's ongoing series where we focus on important issues facing clinician leaders. I'm Elisa Arespaguachaga, Vice President of the AHA's Physician Alliance, and we're going to talk today to 3 women physician leaders who in the last couple of years completed the Women's Wellness Through Equity and Leadership project. Today I'm joined by Dr. Janine Adjo, Chair and Director of the Pediatric Residency at SBH Health in the Bronx. To get us started, Dr. Adjo, can you tell me a little bit about yourself and your role at SBH?
Sure. Good morning, and thank you for having me. So my name is Dr. Janine Adjo, and I'm the chair of the Department of Pediatrics at SBH Health System in the Bronx. I also hold the position of Director of the Pediatric Residency Program for our institution. I began my career at SBH upon completion of my residency program at New York University Medical Center. And I started here as an ambulatory physician. And then as time went on, I assumed more leadership positions. And I was director of medical student education, and then I went on to lead an ambulatory site. I was asked to start a standalone private practice. And then from there, I went into working with the residents. I was asked to be the associate program director for the residency program, and then shortly assumed the role of program director. From there, I was asked to be vice chair of the department, and then assumed the role of chair of the department in July of 2019. So right now I sit as chair of the Department of Pediatrics, and I also sit on a number of committees at St. Barnabas Health System in the Bronx. And those committees are designed to foster the longevity of the institution. And I also am extremely interested in community outreach and have done a few things that have launched us into a robust community outreach program.
So tell us a little about the project that you did as part of your participation in the WEL cohort, and then a little bit about how you've applied some of those lessons from your project work in light of COVID and being at the epicenter of the initial wave of COVID in New York City.
The Women's Wellness Through Equity and Leadership program was an extraordinary initiative. It was an 18-month program developed by 6 different institutions, the American College of Physicians, the American Hospital Association, the American Academy of Pediatrics, the American College of Obstetrics and Gynecology, the American Academy of Family Physicians, and the American Psychiatric Association. And its goal was to introduce mid-career leadership women to the concepts of wellness, equity, and leadership. And over the course of 18 months, 18 women from very, very diverse backgrounds from all across the United States engaged in in-person meetings and also virtual webinars that focused on fostering wellness, equity, and leadership. And so when COVID-19 hit, there was an extraordinary phenomenon, and I think it impacted all 3 areas of our society: wellness, equity, and leadership. And if you look at wellness and you think about it as the complete physical, mental, and social well-being, then COVID and also the byproducts of COVID, which I don't think many people talk about, but the byproducts of COVID ravaged our communities and had an overwhelming impact on our hospitals, and particularly my hospital. I think it also further exposed a profound lack of equity we have in society, and also showed us how important leadership is in trying to steer and quell a pandemic. And so I took many lessons from WEL to help in my role as chair, but I think there were some specific lessons that we learned that actually were very helpful in navigating the pandemic. As I told you, it was an 18-month seminar. So every 6 months was divided into the different categories of wellness, equity, and leadership. And so in our wellness portion, we learned a variety of different things. But the thing that I think stood out for me during the pandemic was learning the risk factors for burnout. And so there were two concepts that really stuck out for me during that session. And we learned about something called mother transference. And that's when, as women in leadership roles, we may take on the mother role at work rather than the leadership role. And as you can imagine, being in the midst of the pandemic, as well as being the director of a residency program with young, blossoming doctors, the role would have been easy to slip into the mother role. And I had to be very mindful of not taking on the role of mother, but leading and providing leadership qualities to my residents as well as my staff members. In addition, we learned in our wellness component about a concept called compassion fatigue. And that's when you repeatedly care for patients who experience trauma. And so as you can imagine, many of our patients here experience trauma, whether it was their loved ones that were getting sick or eventually succumbing to the illness, running out of food, being evicted from their homes. There was a lot of trauma that our patients endured. And being involved in their care and having to attend to their trauma could have caused some compassion fatigue. So recognizing that was something that the WEL Project taught me. And in response to that, I was very mindful to make sure that I created networks that I could utilize to communicate with about how I was feeling and the things that I was witnessing. And it also taught me the importance of self-care. In addition, on our wellness component, we were talking about the importance of gratitude and showing gratitude to the people that you work with for the roles, the incredible roles that they play. And I think during the pandemic, it was obvious that we needed to say thank you to our staff members for the work that they put in. And in particular, I met with my staff, my division directors and my staff weekly, detailing how grateful I was to them for coming into the hospital every day to take care of patients that were sick and then going home, not sure if they were infected and spreading this disease, this virus to their own family members. They put themselves on the line. And so I think showing thanks for all that they did was very important, and that was something that I learned particularly in WEL. Next, I think equity was the next 6 months of our learning, and we talked about how we would be able to advance health equity at work and in our community as leaders. And I think equity was such a big part of this pandemic. We were able to see that depending on who you are, what you look like, and where you live, determines your prognosis with this pandemic. And so for me, it was so important to make this a call to action. So I began to make sure all of my providers understood the importance of equity. And we started talking about bias, implicit and explicit. And we actually brought in speakers during this time to give grand rounds to not just my department, but the entire institution about recognizing bias. Once you recognize it, it becomes much easier to do away with it in order to resolve the issue. And I think that was very important here in our institution since we serve a primarily Black and brown community that was disproportionately affected by this pandemic. One of my goals right now is to work on the public vaccine administration. And since St. Barnabas sits right in the middle of a very Black and brown community, and since that community was heavily hit by the pandemic, I want to make sure that we are first in line for the vaccine. And so now I'm starting on an initiative called the Vax Chat, where I want to have conversations with community members about the vaccine and answer any questions that they have, because there's a lot of misinformation out there, and I want to make sure that this community knows the truth so that they can protect themselves from this disease. And then lastly, leadership. Leadership was the last part of our 18-month experience, and so we spent 6 months on leadership. two big things that I took away from leadership were the importance of communication. That was the first thing. And so during the pandemic, it was vital that you spoke to your department members about what was happening. Data was so important, and it led us to finding good treatment options for patients. It led us to learn how to mitigate the spread of the disease. And it also taught us how to best see our patients while maintaining social distancing. So it was so important that we utilize communication during this pandemic. And that was a good lesson learned through WEL. And the second big thing I learned during leadership, I think, that helped me with this pandemic was the idea of transition and change and launching new ideas. So the pandemic forced us into a place that we had never been before in medicine, and that is the use of telehealth. Now, while telehealth had been around for a long time, we had never really utilized it here. You mainly saw it in remote settings where patients had difficulty getting access, physical access to physicians. But the pandemic changed that. And because we had to maintain social distancing, telemedicine became the tool of choice to maintain contact with your patients. And so when launching a new idea that people are not used to, we were taught at WEL about following a key procedure. And it was the 4 Ps: purpose, picture, plan, and part. And so with the purpose, you want to discuss the outcomes and what you're expecting. And so with my department members, we began talking about why we're using telemedicine, what the importance is of maintaining contact with our patients so that we can make sure they continue to be well. We talked about the picture. So how would that look? What is telehealth going to look like for us and our patients, and how can they benefit from that process? Then we talked about the plan. How are we going to roll out telehealth so that our providers get it and also the patients that we care for understand the tool? And lastly, we talked about the part. What is each person's role in determining how we roll out telehealth so that it is beneficial to both our community members and the providers? And so I think those two aspects of leadership were very, very helpful in defining my role as a leader during the COVID pandemic.
It sounds like this program really shared some key factors and tools for leadership and equity and wellness, all of which just amplified by the pandemic and what you experienced. I love the idea of thinking about community conversations about the vaccine. And I know AHA has some work in that area as well, trying to help support our members in having those community conversations so that people understand what the vaccine is and isn't. And I really love the idea of communication. There's no way to get around it. You have to keep communicating.
Yes. And it was so important during this time.
So for our listeners, what advice do you have for those who are thinking about looking at these 3 big issues, wellness, equity, and leadership, and beyond all the great lessons that you've already shared, if you had to sort of impart a little bit of advice, what would it be? How should they be thinking about it? How should they start if they haven't had the access to these types of programs?
So it's just an exciting and challenging work that you do as a leader. And then having support systems like this program to further what you do as a leader is so important. I'm a big fan of setting goals. So even if you don't have a WEL program, I think you can begin to set goals for yourself that you can achieve. I'm a big fan of setting the goals, but I'm also a big fan of giving voice to what you would like to achieve, because once you give voice to it, you have to move towards it. And I recommend setting specific goals that have waypoints to what you'd like to achieve. So I'm going to do X. Now, how am I going to get there? And list those initiatives below. And as you do each waypoint, you want to check it off, because this is now you accomplishing your goal. I've also learned the importance of mentorship, sponsorship, and networking. And I really advise that if you're interested in doing this work, that you initiate the mentorships, that you seek out the sponsorships, and that you establish and join networks with like-minded leaders that have different career goals. And if you notice, everything is an action. You have to initiate, you have to seek, you have to establish. It's important that you understand that this work requires action on your part. And then finally, I was talking to a colleague of mine on a Zoom chat last week, and behind him on his clipboard, he had a saying that I think is so apropos. And the saying was, there is no elevator to success. You have to take the stairs. And I think that is so important that if you really would like to do the work, that you get ready to put the hard work in.
I don't think I could think of a more fitting way to sum it up. You just have to put the work in. Thank you so much for joining us, for participating in this program.
Oh, I look forward to it. I'm happy to help these women along their career path as well.
And I look forward to connecting you with some of our WEL 2.0 participants as we start to bring that next cohort together.